So here I am, day 4, post learning that I have breast cancer. It's been a very, very fast week, which is a true blessing because I am not good at being patient, and the waiting was really one of the hardest parts to start. I was able to meet with the surgeon yesterday, and she is just absolutely incredible. She is world-renowned, pioneering, thought-leading breast surgeon and oncologist, and she happens to live or work down in Sedona. And after discussing so many complicated pieces, especially because of my genetic history, the type of tumor that I have, which is very small, and that's a whole other story, but it's a complete miracle that they found it. Complete miracle that I came in exactly when I did, and not when they told me I should, and not wait till later. And it's very small, but it's also very aggressive, and the type of cancer that I have is is harder to treat. And so that being said, just long story short, I will be going in on Wednesday. I can't believe it's already Wednesday. It'll be 1 week from the day that I learned I had breast cancer. I will be having a double mastectomy. We're still waiting on some genetic testing and some other testing. They can actually map the breast and the tumor and see how it might respond to different treatments. Unfortunately, the kind of cancer that I have, is not the kind that responds to hormone therapies or other kinds of therapies. It only responds to, obviously, surgery and chemotherapy. The good thing is, because it's so small, she doesn't need to do chemo to shrink it because it's already small. And that means that I don't have to do chemotherapy as of right now. She's also of the mind that with this type of cancer, a lot of other doctors she said most other doctors would just say, because of the type it is, you just have to do chemo no matter what. And she's saying she's more about the science than acting out of fear, which really I loved. And so she's waiting on the science to see the mapping of the tumor and how it might respond to chemo, and if we need to do that after or not, even though we're going to go ahead and go with the double mastectomy because of my intense genetic history. You know, my mom's not only had cancer 3 times, but she's had this same, well, not exactly the same type. It doesn't respond exactly the same way mine does, but the initial type was the same for 2 of her times. So she had a different type the other time, both sides. So that puts me at very high risk genetically. And also, her aunt, my great aunt, actually died of breast cancer when she was in her 80s. And on my dad's side, his sister also has experienced breast cancer. So we have a family history on both sides, and a pretty intense history. And you know, the crazy thing is that my mom has done genetic testing twice. I know there's a lot of you out there who are thinking that, you know, I have a family history, or I want to get genetic testing done. And my doctor was just so awesome yesterday. She sat forever and explained to us what all this testing meant, because my mom's testing came back kind of unknown. Like, to put it in simple terms, basically, like, we don't really know if you have a genetic mutation or if you carry the breast cancer gene. You might or you might not, kind of like a maybe answer. And then it kind of stopped there. The people who did the testing stopped there. And then because her doctor didn't really understand what that means, they didn't really recommend anything. My doctors asked about it. When I told them, they're like, oh, okay. Then they didn't do genetic testing on me. I'm not sure I'm the type that would go for, you know, just getting rid of all the breast tissue without having had cancer first, but I know it's definitely recommended these days. And flat out, she told me yesterday, you're going to save your sister's lives and you're going to save your daughter's lives. And so I feel good about that. I'm a pioneer in my own right. I'm already a cancer survivor, so I can say that, breast cancer survivor. And even if it's technically only in me for a week, which it's been longer than a week, but I've only known about it for a week, and hopefully, fingers crossed, I won't have to do chemotherapy, but I still will probably have to have, we're also going to see on this, but I probably will have to have a whole removal of all my other female parts, uterus, ovaries, tubes, too, because there's such a risk with the type of cancer that I have and my family history of getting cancer in other places too. So it's going to be a lot of surgeries, a lot of recovery, but hopefully no chemo. We'll see on that. And it's just kind of still just one day at a time. Although right now I'm just kind of trying to mentally and emotionally prepare for surgery on Wednesday. They literally moved patients, both the plastic surgeon and the oncologist surgeon, both had to move patients to get me in so soon, which is amazing that they can get me in that soon. It also makes me go, why me? Obviously they're concerned and they want to get this taken care of right away. And I feel just humbled and grateful that my doctor, Dr. Dupree, has taken this so seriously and moved so quickly and being able to, she's like a force to be reckoned with. And so I know I'm in good hands and we're going to make a great team, but she just moved so quickly so that we can just get this handled and be on the road to recovery. So that's where I am. And thank you for listening to my babbling. It's just such a strange experience. Those of you who have been diagnosed with any kind of serious illness or even grief, I feel like this is so similar to grief, where you can be going along fine and having a great day and feeling good, and then all of a sudden the thought comes back that, oh, that person's gone that I love, or oh, I'm getting divorced, or oh, I've got cancer, and all of a sudden it's like you don't know how to feel, So it's kind of this odd process of just waiting. It feels very much like grief to me, waiting to see what emotions come up and then letting myself feel them and go through them, and not really, really trying to check myself so that I don't feel like I have to feel a certain way for everybody else, because that's what I tend to do. That's what we women tend to do, especially we moms, we parents. So I can be strong and tough for my kids, but then I can have my moments where I feel and process too. So that's where I feel like I am, just kind of waking up in the middle of the night and all of a sudden, oh, you have cancer, and trying to get back to sleep, and and then just also feeling really good and grateful and trying to lift as many weights as I can until I can't be doing that for a while, and get out there and move my body because I feel healthy. And I guess, like OJ was saying, you are healthy. It's just one little part of you that's not. But it's weird because when you have cancer, you're suddenly like classified as sick. And I don't feel sick. And but it's like slowly sinking in that, this is serious. Like she told me, the doctor literally told me, she said, you need to send a gift to that radiologist because he saved your life. And I feel like, it's really my Father in heaven who's saved my life, because he's the one that's prompted me to go in and do the mammogram. I almost rescheduled it, and to just help me to know what was going to happen and that it's all in his hands. So I feel blessed, and OJ's up there watching me now, so I'm going to go. Thanks, everybody.